If you have parotidectomy and you wake up and your facial nerve is weak, if your face is weak, how long is it going to take for that to recover? I'm Dr. Babak Larian from Center for Advanced Parotid and Facial Nerve Surgery. And it really has to do with how involved your tumor is with the facial nerve and how much experience your surgeon has. Actually, both matters, right? So as you can see in this image, the facial nerve is going through the parotid gland, right? And you can see the branches coursing through it, right? Now, if the tumor is superficial to the nerve, right, and you can easily peel it off, right, or if it's not even touching it and you peel it off, there's less contact, less chance of bruising. If the tumor is underneath it, right, so if the tumor is underneath the nerve, as you can see in this image, then you're gonna have to dissect, separate the nerve here from this tumor in this area, and then get the tumor out from underneath it, which means there's more of a possibility of swelling and bruising around the nerve area. But again, the more experienced your surgeon, the more gentle they are, the more gentle hands they have, the less likely it is for this swelling and bruising to be impactful on the functioning of the nerve, right? And the nerve fibers have, you know, when you look inside a nerve fiber under the microscope, there's millions of fibers going in there. And so they can easily, a few of them get swollen and bruised and function less. And in the worst case scenario is when tumor is wrapped around the nerve, in which case you have to basically cut open the tumor and dissect the nerve out, right? So I can't really tell you how long it's going to take for something, a weakness of the face to recover. And that really has to do with the amount of swelling you have around the nerve, right? But if your nerve is partially moving, so if you move your lip, right, and this side is still moving, right, just not as much as the other side. I'm not doing a good job demonstrating, but if it's moving but not as much as the other side, as long as it moves, you know that the nerve is intact, right? And it hasn't been cut. And that nerve will usually, I'd say more than 90% of the time, 95% of the time, recover fully and function fully. So it's just a matter of time. Can you do anything to speed it up? You know, I think if you make the environment appropriate for healing, sleep well, eat well, exercise moderately, then you create an environment that's fertile for healing and things will heal better and faster. Anxiety and stress will get in the way. So if you know that your nerve is working partially, at least that gives you some relief that you know that it's going to recover fully. If you're interested in clear parotid information, visit us at parotidmd.com. Be well.